I am presenting Zeidler Partnership Architects. We are what's called PDC for this process.
Like we are. Speak into the microphone?
Well, I'm not used to that, but I make my best. So I am representing Zeidler Partnership Architects. It's a Toronto firm, about 100 years. We have a lot of projects around the world, probably about 45 hospitals built around the world. You're probably familiar with Eaton Center, Ontario Place, and a lot of other public facilities that we are the architects. You can see here three of the big hospitals in Toronto that we design: the Sea Kids, Atrium, Princess Margaret, Sunnybrook Hospital, so something to show you where we're coming from. But I'm not only an architect, and I'm not only part of Zeidler, I'm also have kids. And in this Sea Kids, my personal story is when my child was 10 years or 9 years old, it's many years ago, and he had a procedure in Sea Kids. So, as a parent, you are a lot of pressure and to prepare the kids to get to this procedure, and you're telling a lot of story and you're showing books and you try to, to have him ready for this experience, probably us more than him. And finally you're doing that for 2 weeks, 3 weeks, and then you're driving. I remember I driving and I'm in the rush hour and I'm stuck in the traffic and half an hour, and all the time he asks me questions, I'm answering, and finally we got to Sea Kids. And what is the question that he's asking me as 8 years old? He say, "Dad, where is the hospital?" So I believe that that's the best award that architect can get, even better from the general award of Canada. The kids get to the Sea Kids, but it doesn't feel that it's in a hospital. And that's what we're trying to deliver here. So just to give you the context, we are talking about this region, that's the local area hospital. You can see the Richmond Hill Hospital. On Major Mackenzie to the west, in about 8 kilometers, that's the new site for Major Mackenzie Vaughan Hospital. And around this area, including the new hospital, it's about 10 hospitals from the north, the South Lake, to the south, Sunnybrook and Blueview, to the east, Markham Stouffville, and to the west, William Osler. So I'm zooming in to the site, and just to give you an idea where we're going to have this new Mackenzie hospital. So it's between 400 on the west, Jane to the east, Major Mackenzie to the south, and probably everyone knows what's going on here, the Canada Wonderland. That's our neighborhood for the south. So kind of very exciting neighborhood to get an hospital. Zooming in, that's really the site that we are starting to talk about, and really what is the character of the site, that you have a neighborhood on the north, residential low-rise housing. You have some commercial in Jane Street, but really on the south, on in the west, you have highway and you have a huge parking lot for Wonderland. What you can see also from this scheme is where will be the approach to the site. And the approach today, you have an entrance from the north side on Jane Street. We're going to introduce another entrance with the intersection here that connected to the commercial part of the side of Jane. And from the south side, we'll introduce main entrance for Major Mackenzie and a connection from the Wonderland that it's part of the exit from the parking from the Wonderland. So really, you're going to have really a couple of focus entrances to the side, and you can see clearly that we are taking a distance as much as possible from the neighborhood to give this quality to keep the quality of the residential in the north. That's what we're calling the precinct plan, and that's a plan that's provided by the city of Vaughan, that creating the main zones on the site, and this plan was approved by the council a couple of weeks ago. And really what you see in the blue, it's block 2 and block 3 that actually is the hospital end. When block 2, it's the current hospital construction, and block 3, it's the future hospital future expansion. All the other blocks, 1, 7, 4, and 6, etc., are blocks that are for kind of facilities that are related to health. If it's a long-term, if it's an education, if it's a research, if it's an office, a medical office building, all kind of facilities that somehow related to this hospital. So what really we see here, that we have a very exciting opportunity not just to design a hospital, it's to design an entire district of the city of Vaughan. Somehow we're starting feeling like, you know, a district of health and wellness. That's a lot of things around this idea. Not when you are sick, you have to be here. Only how you creating a quality of life and education that provide you a better life. And that's part of this district on the design. One of the concerns that obviously the people that living on the north side, and that's imagine to yourself, we're cutting the site vertically, and that's the small houses. That's the small houses on the north, and that's Major Mackenzie on the south. It's really to create a buffer zone, or what the city called transitional zone, that we are reducing our height or going down to have buildings that not blocking those residential. The maximum height that the city of Vaughan allowed us to build is 75 meters, and that's a very common height for the many developments now in Vaughan. And you're asking yourself, what is 75 meters? So we gave you an indication that the roller coaster in the Wonderland, it's 91 meters. So the maximum height, it's about 20 meters less than the roller coaster. And you can see here the profile, and that's the building that was submitted in the stage 2 before, and that was about 11 floors that fit very nicely with those limits. But the most important, it's really this zone here that creating kind of about 135 meter or 400 feet zone that we are not able to achieve the maximum height. So really the story here, we're building a new neighborhood, but we're always looking what existing around us and respecting the life of the people around. That's just a very brief view of this district, and just to give you the orientation, Major Mackenzie, Jane Street, Wonderland parking, 400, it's someplace there. That's part of the site. And and that's the stage 2 that's submitted to the ministry. We are starting from this is our start point. And what we're taking from the start point, we're taking two things. One, the main hospital building will be located on Major Mackenzie. Mackenzie Health between Richmond Hill and Vaughan. This kind of physical location will create kind of appearance of the building on the Major Mackenzie. The second thing that we're taking from this plan is the access to the site, as we described before. And here we can see that we are respecting the existing entrance from Jane Street North, creating another entrance on an intersection here, and the entrance for Major Mackenzie. And otherwise, you can see that no connection between the residential and between the hospital. That's our start point, and that's where we are today. So, a little bit excitement. It's about how we think the healthcare design going. And I'll share with you some ideas, some inspiration photos that are in our mind, in our hospital, how we want to achieve this new building. And it will be about 3 areas. One, it's what's the meaning of the community hospital. So we believe now that community hospital, it's a community event. We want to take the boundaries down between the hospital and the community. And we'll show you what we mean about this interaction. We also believe that the benefit of better architecture is to create environment that invoke an emotion response. And the emotion part of us as human beings when we're going to a hospital, it's huge. How we are doing this space to impact this emotion. And the last thing will show a little bit some clinical spaces, different way to deliver care that we are used today. So a Dutch architect, Aldo van Eyck, said, the village, it's a house, and house is a village. And what is really meaning of that, and you can see a beautiful piazzetta from Italy, probably some people know where is this piazzetta, and really you can see that the public space and the house, it's really one big event. You cannot see, you don't see the boundaries anymore. So really what we're looking for, we're looking to create this idea of the village as a hospital and the hospital as a village. It means hospital with no boundaries. So what I mean about that? That is the traditional hospital that everyone is familiar, and that's the way the hospital was designed and built 40 years ago. And really, what is the relationship with the people outside? It's really, you have all the public spaces, you know, a little bit of cafeteria, a little bit of gift shop, a little bit kind of stuff for public, but you have to go through, you know, a small door, a vestibule, you have a huge asphalt parking, and really the entrance is just a vestibule and doors. That's the way you're interacting with the hospital. We are looking to take this event of the public area and to break it down to a village idea. So instead to come really through a parking lot and through a door, we're looking to create a feeling of a village. And just, you know, imagine a little bit, that's what we're doing 24/7, imagining ourselves. You're going through a cafe, you're going through an education, you're going through a retail, you're going through a pharmacy, you're going through kind of a lot of activities that you are used from your community. You have a different scale of gardens, some of them cover, some of them not cover. It's not really moving through a door and a vestibule to have a climate protection. It's really to integrate the community and the movement of the community from the normal life to this building. And that's an example that we are now involved in Brampton, the new Peel Memorial, that's an ambulatory center, and it's the same idea of creating a district of health and wellness. And you can see here, this is the hospital, this is how it's integrated with the street, auditorium, coffee, balcony, park in the middle, a medical office building connected with the hospital, some residential, protected residential, long-term, around pedestrian. It's open itself to the surrounding area. It's not closing itself to surrounding area. And that's an example from Austria about a hospital, a community hospital, that really you don't see the boundary between the piazza outside and inside. You're going through and getting inside. And that's a hospital that we designed in Tel Aviv, and you can see how this hospital, the lights, it's not great here. That's probably a complaint to the architect that designed this building, right? How you approach the street and how the hospital open itself, the entrance to the street. And that's another design that we did for children treatment, that really the entrance to this building, it's through the landscape, through the garden, and how you slowly getting from totally outside to the inside. So that's a couple of examples to give you the idea what we mean by community hospital and taking out the boundaries between the community and between the hospital and the opportunity to design an entire district. So our architecture can impact an emotion. Zeidler, the founder of our firm, said actually that you cannot separate between body and mind. It's really everything in our kind of human. The rational and the emotional coming together. It's two poles that cannot be separated. And really what we're talking about, let's not forget technology, washroom, private room, Everything is cool. In the end of the day, let's remember, we're talking about patient. That's are the center of our thinking, the human being. And all this patient journey through the clinical, if it's a diagnostic or assessment or treatment, it's really around the patient. It's not the patient around the services. So if you're looking on the patient, you're really talking about something that every one of us feels when we get in this environment. If we are a patient, if we are a family member, if we have an old parent or a young child, or any kind of other environment. Why we need to feel what is this list here. And I want just to go through a very kind of abstracting a lot, how we approaching, how we can deal with that, with this stress and anger, fear, etc. So let's try to imagine ourselves, and that's like imagination of walking through a gateway. You're not really immediately facing the new space. You are getting through a gate. But you have something like a bridge that you have a time to prepare yourself to the new environment, and a lot of relaxed space happen around that. And then when you're getting inside, you have a greeting space. You don't have to come immediately to the registration. Now, all what we're saying have to be functional work, distances, respecting accessibility. That's our complex and our responsibility to design, but we want to create, imagine ourselves different spaces. Greeting space that somebody welcome you in different way. And then if you need to interact with a doctor, or you want to interact between you and your family member, or between your patient, let's try another kind of environment that, you have a fireplace, you can see outside to the garden. And all this environment, it's around oasis. Indoor, outdoor, it's a very critical element. So I'll show you a project that we are building now in Hamilton's Health Science in Hamilton, obviously. And that's a small project in the hospital that really, and get an international award for this idea, how this movement translated. So when you're getting, that's a breast assessment center in Jarvinsky Hospital. So when you're getting from the street, you have this feeling of, something welcome you as a bridge. And then you have a movement of bridging inside through a garden that you can pause, sit, think about it, relax before you're getting in. And when you're getting in, you have a greeting space that welcoming you inside. And then when you want to break out from the clinical area, when you want to sit with your family member, if you want to speak with the doctor, not in most private way, but one by one, you have this place of interaction that you can see the relationship between inside, outside, the natural light, the garden outside. But you have the kitchen that you can prepare your coffee, feel like home. Or you have your fireplace here that you can sit next to the fireplace. And you are part of an oasis. So inside, outside, it's part of the same life. That's a very simple way to think about how to craft the environment, and that can be done in small scale and in the big scale as well. So what we want to offer you in the new hospital, we want to offer a space that provides human-centered experience. It's about us as human beings, and about community and not about separating from the community. About a space that say, welcome in, no, you are not welcome to the space. To create, not to disconnect you from the natural life, it's lighting, ventilation, the things that you used to have in your house, in your community, in your street. And to keep the nature in. I'll show you some pictures of some projects that really talking about that. A design that we did for the Seoul, Canadian Embassy in Seoul, South Korea. And that's the garden. And imagine to yourself, you have a treatment here inside, but you're looking on this garden, you have the opportunity to go in and out. That's an example from Denmark about what is the inside, outside. Look how many opportunities every person can find its place if it's in this bay window here, if sitting around the tree or around the flowers. And that's an example of hospital in Dublin, Children's Hospital. Patient, from accessibility point of view, cannot always go to the nature, cannot always go down. Let's bring the nature up to the patient. And that's a children's place. You can see the gardens, you can see the playground. They are part of the spaces of the treatment going up. Obviously, we have to care about safety of the patient and children and all that. It's part of the design. But the idea, let's bring the garden from down out, not always patient can go down to the garden. And the social, how you are really have a space that it's pleasant to sit and to feel the space and to feel that you are comfortable. That's an example of our design in Moore College in Hamilton as well. That's the way we're connecting the sitting and the circulation between the indoor and outdoor. That's another picture of the hospital we built in Tel Aviv. You can see the circulation. So if some people can take the stairs, and we see more and more the stairs become kind of a feature that, it's nice to have. Obviously, you have all the elevators and all the accessibility, but you have doing something that you are part of the entire hospital. And that's in Hamilton, how welcome it's an entrance and how the relationship between the inside, how the natural light going through, and how you feel you are not in a hospital. So the last part of my presentation is focused on more clinical area, surgery, intensive care, emergency, and inpatient. And we'll show you just an inspirational images all around the world, how those departments going forward, hopefully we can achieve that or part of that. So, Dr. Herman, he's going to the OR, 7 o'clock in the morning, and he probably leaving about 7 o'clock in the night. I give you a compliment? Very good. Probably is leaving 10 o'clock. Okay, everyone thinks going to the OR, we don't care about anymore because he is responsible to take out, right? So we're totally out. He's doing a very good job. We don't know where we are as a patient. First of all, that's not the true anymore, right, Dr. Herman? Because many of the patients are still aware to the environment. More and more procedures are able to make you more aware to the environment. The doctors, the staff, the nurses, they working there. That's their workplace. You want them to feel comfortable. Trust me. If they feel comfortable, you feel comfortable. And we want to introduce the idea that not always it's possible from any other regulation, why the OR cannot open itself to the outside, to see the garden, to have nature light, so they know it's 7 o'clock in the morning or 7 o'clock in the night. Obviously, all kinds of technical regulation and controlling light and privacy, everything can be achieved, but that's a different way to think about OR. When you're moving out from the OR to the PACU, to the recovery, what you want to have as a patient in the recovery and what the staff want to have in the recovery. So first of all, it's very important to have the eye connection between the nurses, physician, and the patient, because that's how your recovery, it's in the face in their eyes. But you want to create a privacy, you want to feel more enclosed, infection control. That's an example. Open, visibility, but separate. By the way, today you are able to push the button, the patient, next to the bed, and this glass can be totally visible or totally obscured that you can see nothing. So you're controlling your visibility through the glass or the stuff through a button. So the technology is there to support us. It's only issue how we are thinking about this environment that we bring to the patient. ICU room, moving more and more to, it looks like a satellite, right? So all the technology, all the information, all the interaction between all the sources is all around the patient and the staff. But let's not forget, we're talking about human being. As much we are introducing more and more technology, we're still looking for window, outside, nature light, garden, that you feel where you are and you are not forgetting from where you're coming. Dr. Ehrman spoke about all the relationship between the nurse and the patient. We are looking to bring, it used to be big nurses station in the middle of the unit, that when you're walking around, nobody is there. Why nobody is there? Because actually the nurse should be next to the patient. So let's bring the workstation to the nurse, not the nurse to the workstation. Let's bring it as closer to the patient to have this interaction so they're not wasting time far away from the patient. And that's an example of another intensive care that, every nurse has their own chart corner. But look what makes me happy on this picture. It's not really the nice nurse. Sometimes this can make me happy as well. But the small bench here next to each entrance to each ICU. Just to go out as a family member, to sit a little bit, to relax, to speak with the nurse outside from the patient, that makes a lot of difference. And we have different way to do it. It doesn't mean that that's the only way. But the idea, it's here. Emergency department. Again, the visibility for the staff, the opening, the interaction. We are talking today on multi-professional discipline. It's not only one person that making the decision about your health. You have many people that have to speak between themselves, they have to consult themselves, and at the same time they want to see you. But in the other end, you want to feel the privacy in the emergency. You don't want to feel this opening with the curtains, as used to be. So that's a beautiful example of the piazzetta. Hopefully some people understand Italian here. The piazzetta, that it's really the hub of the emergency. Look on the height, look on the art, look on the light. But the privacy and the visibility of the patient, it's still very much achieved by the spaces all around. Obviously, we have storage. Obviously, we have some spaces that have to be private. All this kind of stuff, starting creating idea. But what is the feeling here? That's what's important. And another example for kids' hospital, how the staff looking to the room and how they are sitting together, how they're interacting. Less formal. This, you have to think about it. Those people live here 24/7 for 35 years. We have to think about them to create them the best quality of working environment to be able to provide the best care for us. And the patient bed, private bed, semi-private bed, everything it's kind of, and again, the private bed, 80% is the ministry policy now. So all the hospital around the province, by the way, around I believe Canada, it's in this ratio. But it's not only to be alone or not to be alone, or to have a washroom and not to have a washroom that have very much importance for many, many reasons. By the way, the ministry decided to spend money and to make private rooms because it's cheaper to make the private room in the infrastructure and to avoid many infection control problems when you have 3, 4, or 6 patients in the room using the same toilet. So somebody's looking on long term. But look on this window and the view to the outside. Look on this small counter that you can put your laptop, or you put your picture of your grandson, or you can put a vase with flower. That makes all the difference. And that's the mental health, and we have a significant mental health, as Dr. Herman say, in the new Vaughan. Mental health, we have to change the view to mental health. It's totally normal people like us, human beings. They sick like other people sick. We have some restriction, some safety, but doesn't mean that the room doesn't need to be connected to outside, doesn't have to get light, doesn't need to have this small table with a computer if they're able to do that. Human being is there, and that's our example from St. Joe's in Hamilton. We're designing a huge mental health facility. How's the human being sense coming here? And children, that's in London, Hopkins Architects, beautiful hospital. I don't have to say anything. Look on the coloring, look on the joyful, look on the light, look on the connection outside. Kids want to see what's going outside. Kids want to enjoy for people walking. They don't really care about privacy. Always you have the curtain, you can close the curtain, but they want to be part of the normal life. And that's, again, in Australia, in Melbourne. That's the clinical area, and that's where family is sitting. how they see the children or see the family member. You always have the privacy, but you have this interaction. And that's another project that we did in See Kids, parents, children, treatment area, and how this environment become different even inside the hub of the unit. And I'll finish this presentation again about staff. When they need the break, they need the break. And we don't have to push them to a 10-meter room with a small window if we are able to get them a window. We want to give them the best environment. And imagine to yourself the staff member sitting together, connected to the garden. That's a beautiful, beautiful space that the interaction between in and outside, it's here. And what's the feeling to take a break an hour from the OR and to change the environment, to see the light, to see the trees, and to interact with other members. And that's another example of work area. So I'm going to finish this presentation with a piece of art. And I'm not going to say a lot because everyone can look at this piece of art and feel different. For me, for us, that's how we understand the design. It's about emotion, and everyone has his own emotion. It's about interaction, community, with the patient, with the family, interaction with the staff, and it's about connectivity. That's what this means for me, and that's what we're looking to do in the new hospital. Thank you.